An analysis that formed basis of a Florida Surgeon General's much criticized advice warning young men not to get COVID-19 vaccine skipped information that showed contracting virus could increase risk of a heart-related disease. Tampa, Florida. An analysis that formed basis of a Florida Surgeon General's much criticized advice warning young men not to get COVID-19 vaccine has skipped information showing that contracting virus can further increase risk of heart-related. More than just mRNA hit, according to analysis sketches obtained by the Tampa Bay Times. The non-binding advice made last fall by Florida Chief Physician Joseph Ladapo went against advice provided by the Federal Centers for Disease Control and Prevention. Ladapo, a Harvard-educated medical doctor appointed by Florida Governor Ron DeSantis to head the Florida Department of Health in 2021, has come under intense scrutiny for his shared resistance with the Republican governor to COVID-19 mandates for vaccines, masks and other products. Health policies approved by the federal government. Early drafts of analysis, obtained through a registration request by Times, showed that contracting COVID-19 could increase chance of heart-related much more than getting vaccine, but this information was missing in final version. Florida Department of Health last October. The risk of cardiac complications for men ages 18 to 39 outweighs the benefits of getting the mRNA vaccine, Ladapo said. Matt Hitchings, an infectious disease epidemiologist and professor biostatistics at University of Florida, told Times that parts analysis were omitted because they didn't fit narrative general surgeon wanted to push. This is a serious violation of research integrity, Hitchings said. Has done a lot to improve the health of Florida people and encourages people not to rely on it. In response to the Times story Saturday, Ladapo said on Twitter, "It's not only unfortunate COVID has disrupted scientists' ability to think clearly about epidemiology, but it's also unfortunate that people are rushing advocate a vaccine is the rise in cardiovascular disease, sad. Risk in multiple studies." Last year, Ladapo published guidance recommending that healthy children not be vaccinated, contradicting federal public health leaders whose recommendations are that all children should be vaccinated. In response, the American Academy of Pediatrics and its Florida branch issued written statements reiterating support for the vaccination of eligible children 5 years and older against COVID-19. DeSantis, who is considering running for the GOP presidential nomination, has also requested that a grand jury be convened to investigate any wrongdoing with the COVID-19 vaccines. DeSantis' request argues that pharmaceutical companies have a financial interest in creating an environment in which people believe that receiving a coronavirus vaccine will ensure they cannot spread the virus to others. The Florida Supreme Court granted the request last December.